Brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Hafide, welcome back to Healthy Living. The doctor's in the house. Dr. Lom, thanks for joining us every week. Tonight we are talking about pneumonia.
Yeah.
Okay, so let's just begin. What exactly is pneumonia for people who aren't aware?
Yeah. Well, you know, people might ask what's the difference between pneumonia and bronchitis, something like that. Pneumonia is an infection of the lowest part of your lung, of the actual sort of meat of your lung. If you think of the breathing tree, you have your trachea, that's the biggest airway, and then it breaks down into smaller airways. Some of those are called bronchi. And then when you get down to the very bottom, you basically have a sponge-like material, okay, full of air. I always compare it to a sponge. And the infection is there in the actual sponge part, not in the breathing tree of tubes that goes down. Bronchitis is an infection of or inflammation of the tubes. This is of the actual sponge. So that's different because the sponge is where you exchange your air, your carbon dioxide and your oxygen. That's where breathing takes place. So when you have pneumonia, it's a much more serious illness than when you have bronchitis, which is basically in the airways. You're still breathing fine. You just might have a cough.
So then I guess there are different types, right?
Yeah,
of pneumonia, if you
there
can
are
break
many
that down.
different kinds. So we have bacterial pneumonia. The most common kind there is strep. You've heard of strep throat. That's caused by a bacteria called strep A. But you also have strep pneumonia, and that's a different kind of strep infection that affects the lung and causes pneumonia. There is also very commonly, most common actually, is viral pneumonia. And this is where people basically have a runny nose and cough and fever, and their lungs are infected, but not with a bacteria. Then you can actually have a fungal infection of the lungs. That's very rare and uncommon, and usually occurs in people who either are cancer victims or have the HIV or some other immunocompromised state where their lungs are so weak that fungus can actually get in there and create an infection. So those are the three main types.
And what about the symptoms? Are the symptoms the same for all the different types of pneumonia?
Well, as you can imagine now, if the lung itself, where the air exchange takes place, is infected, you're going to always have shortness of breath. That's your number one symptom. You may have fever. Typically, people will have fever, and almost always they will have a cough. They may have wheezing at times, and they will always feel extremely weak and tired, right? Because the lungs, again, is where you exchange your oxygen and your carbon dioxide and where breathing takes place. So when that's infected, people are very tired and weak.
How does one, I guess, contract pneumonia?
So pneumonia is an airborne disease. Typically, you will inhale germs that cause infection. And so the best way to prevent that is if you yourself have a cough, please cover your mouth, wash your hands. Some people do wear masks, and if you're around other people that are coughing, again, you would want to protect yourself, washing your hands, and basically trying to stay away from those people who are seriously ill, coughing.
Is it contagious, or?
It is quite contagious, yeah, it is. Depending on the type of pneumonia and depending on your own immune system. People that are more susceptible to pneumonia, we already mentioned weak immune system. Smokers, okay, get pneumonia. Older people, young children with asthma, people who are already sick with some other disease, for example, diabetes, kidney disease, other dialysis people, all those type of people are more prone, but especially smokers.
What are some of the, I guess, the complications?
Yeah, so if you have pneumonia that's you know, in its early stages, and you go and get antibiotics now, this is a very curable disease. In the old days, people used to die of pneumonia. That was like number one or number two cause of death, you know, especially in the winter months. Viral pneumonia from the flu, for example, that was a common cause of death. But complications include getting a lung abscess, where part of that lung is so infected that it basically becomes like a pus pocket. Then that actually has to get drained. Other complications include actual death of part of the lung, where again that piece might have to actually be removed. We call that lung necrosis. And then because again of the fact that you're not oxygenating, you're not exchanging the air properly, other body systems can get infected, and then that goes into something called sepsis, where the person is basically sick in their entire body. Their entire body is infected with bacteria or bacterial toxins, and their liver fails, their kidneys fail, and they become, they're an ICU patient. And that's when sometimes they die. So we want to always prevent that level of pneumonia. So if somebody's feeling short of breath and coughing and having a fever, that's time to go get checked.
I've heard this term before. What exactly is walking pneumonia?
Yes, it makes it sound like the pneumonia is walking around. Yeah. Well, back in the 20s or 30s, when they first sort of identified what germ was causing pneumonia, because they didn't always know that it was bacteria, they discovered that most of the bacteria that caused pneumonias were strep. But then there were some other kinds of pneumonia that didn't look like strep, didn't respond to penicillin, and they weren't, the symptoms weren't quite as severe, but it was still a pneumonia. We always can see a pneumonia on a chest x-ray. Normally on a chest x-ray, your lungs are black. When you take an x-ray picture, the lungs are black because they're full of air. So there's nothing, whereas the bones are white because they're solid. So if there's pneumonia on a chest x-ray, you'll see a patch of white in the black lung area because that's liquid or pus, so it'll look white. So we can diagnose it on a chest x-ray. So back to the walking pneumonia, what would happen is that they would have a pneumonia on a chest x-ray, but they really wouldn't be to the same level of sickness. They would kind of look better than their x-ray. And so they began to call that walking pneumonia. In the end, we've discovered now that bacteria is usually a bacteria called mycoplasma. It's a different, very tiny bacteria that can cause this. It's different from a virus. It is treatable with antibiotics, but just a different one. It doesn't respond to penicillin.
And so that's basically the treatment, is just antibiotics?
Antibiotics, yeah. So with sort of walking pneumonia, you still would have cough, you might have wheezing, you might have fever, you might have shortness of breath, but you're not as sick as somebody who has like a strep pneumonia. So you would get antibiotics. Recovery from any kind of pneumonia is slow. It's not like a cold. Typically if somebody has a pneumonia, they don't bounce back in 2 or 3 days. Even from like a bronchitis, you might be okay in a week or so. Pneumonia people, they have a slower recovery up to a month before their energy is back.
Okay, well, we're going to talk more about pneumonia after the break. We're going to take your questions. Stay tuned.